Welcome back, viewers at home, and thank you so much for tuning in right here on Prime Live. Now, I am joined by a healthcare leader with over 20 years of experience in the pharmaceutical and health tech sector. Now, that is Nomfundo Khabela, who is dedicated to improving the health and well-being of all who call Africa home by focusing on sustainable, cost-effective solutions. Now, her passion for value-based healthcare, especially in the African context, drives her work to create meaningful change across the continent. Nomfundo, thank you so much for joining us once again, and welcome to Prime Live.
Thank you for having me back.
Now, I remember last week closed off our conversation on, I think you spoke a lot on the importance of eating healthy and what it does to, how it contributes to the healthcare system as well as to the person, most importantly. But I think just to help our guests who probably are joining for the first time and missed the first interview, I'd like for you to just give us insight in terms of understanding the value-based healthcare system, especially in the context of Africa, because we're seeing it's slowly getting momentum, but I think we were hoping for more rapid and a more faster pace for it.
Absolutely. So as you've mentioned, value-based healthcare is my passion, and it is gaining a lot of momentum globally, and particularly within the South African context, having been embedded within the NHI framework, which we are now looking to start implementing as a country. Value-based care essentially has come in as a solution for lowering or stemming the rampant escalation of healthcare costs across the world, and particularly in South Africa. And what it does is that for every encounter that a patient has, the doctor who is the responsible party for caring for that patient, either the doctor or the hospital, which are we categorically call healthcare providers, are paid for the patient's outcomes, as opposed to for every encounter that the patient has. So currently, the most predominant reimbursement structure in healthcare is called fee-for-service. And it's exactly what it says. It's a fee for the service that healthcare provider gives you at a moment in time. So let's take, for example, I am diagnosed with diabetes as a private patient. I would pay my GP, who would then send me to a pathologist to get tests. I would pay for those pathology tests. Then I would get the tests back. The doctor would refer me to an endocrinologist. I would pay that endocrinologist, and they would send me for more tests. I would pay that pathology. And if I needed hospitalization for any reason, I would pay the hospital or the hospital provider of care in that instance. So it's very fragmented payment structure. Whereas value-based care says you create a team, a treatment team for that patient, and they get allocated a cost, or they get allocated a cost per patient over the duration either of the event of treatment or over the duration of the patient's health care, chronic health care, if it's diabetes, for instance. And a certain amount of money is paid, and it's paid in tranches based on the patient's clinical outcomes or patient outcomes as are important to the patient. Yeah.
Now, I remember even our last conversation, you spoke on, why your focus is in Africa. And I mean, you even hinted on the disparities between the public and that of the private, and looking at, the income levels of many South African citizens or African citizens within the continent. I want to know from you, and just to sort of remind us once again in terms of why is it important for the African continent to now look into, implementing this value-based system, and what impact do you foresee it having within the continent itself?
Absolutely. It is imperative that we moved towards a value-based healthcare, reimbursement model, because, again, of those disparities that you spoke about. There's a very small percentage in many countries, and especially in South Africa, that have access to good quality international level type healthcare, whereas the bulk of the citizens of this country only have access to whatever is available through government. And I'm not saying it's poor, but it's not adequate given, healthcare, personnel resource shortages, infrastructure shortages, etc. Now, value-based care says for those private patients, and even patients who are dependent on the public sector, the cost of healthcare is escalating at an unmitigated rate. If we look at what we're paying today for, let's say, oncology treatment versus what we paid 10, 15, 20 years ago, it's astronomical. Anybody will tell you that if you are diagnosed with cancer, that stands the chance of completely bankrupting you as a family. So value-based care says, let's look at what we call the iron triangle of healthcare. Firstly, it's access. Access is absolutely important. Secondly, it's quality. How do we guarantee quality of care? And then thirdly, it's looking at the costs. Now, quality of care speaks to what are the outcomes that we're measuring that are important to be tracking, and particularly important for the patient. Last time I spoke about putting the patient back at the center of healthcare, whereas historically it's always been about the healthcare industry being at the center of healthcare and patients having to navigate around it. Now it's value-based care turns it on its head, and it's actually in some instances called patient-based care. So value-based care says, let's look at that iron triangle, let's look at balancing it, let's make sure we bring down the cost of healthcare so we improve access. We then bring down the cost of healthcare so we're actually being more efficient, we're getting better quality for less money. But we're also then obviously reducing the overall cost of care. And again, it's not the cost per incident, but it's the total cost of health of the patient treatment plan over the duration of their illness.
And this is quite, I think it poses a bit affordable to the many individuals, because if you look at the little costs and you sum it all together, it doesn't even make sense. I didn't even get the treatment and I've already paid so much. Now we know that coming up with a system of this kind that will benefit every individual who's going to be a part of it, it comes with its own challenges. I mean, we saw with the NHI being introduced, there were a lot of conversation of what if I can't afford the 1.5? What if on all these other scenarios? I want to hear from you. What would you say are some of the challenges in implementing the value-based healthcare system within the African continent, as well as how do we then go about it in terms of overcoming or addressing those challenges?
Sure. That's a really important question that you've asked. Some of the challenges involved within the implementation of value-based healthcare, particularly on the continent, although I don't think our circumstances are unique, I think there are global challenges that other countries are also facing in the implementation. And first and foremost, believe it or not, it's around the adoption by doctors. You can imagine for decades, doctors have been paid, whatever rate that they deem to be applicable for them and their expertise and their time. And now we're turning that on its head and we're saying, no, you will get paid based on patients' outcomes. And that's really where the biggest change comes in. It's in the reimbursement of healthcare professionals. And there's a little bit of pushback because, as you can understand, if you've studied for so long and you've gained expertise, you want to be fairly reimbursed. You don't want to be compromised by this new reimbursement system. Now, the nice thing or the interesting thing about value-based care is that you can actually make more money with value-based care if you're a doctor who follows the protocols, ensures that your patients are meeting their patient outcome milestones, and then there's additional incentive bonuses that typically, based on your value-based contract that you're entered into with a funder, you would then get additional reimbursement levels or incentives that kick in at that point. So, it stands to chance that you could actually begin to make more money by just following the processes that are outlined in contracts.
And I think also in some way you can say it socially connects us on a human aspect, because you no longer see your fellow patients as that money that's coming in, but someone that you want to see them walking on their own 2 feet if someone is struggling with their legs at the time. And now looking at the idea of technology, we know the digital world is here to stay, and if we do not integrate it within our societies and many businesses, we're going to be behind. I want to know from you in terms of what technologies are being implemented within the value-based system, as well as what role does it play in assisting in achieving that sustainable as well as cost-effective solution.
Great. So essentially, if we look at the value-based model, there's 6 components of the model, with the 7th one being a very prominent foundation of an interoperable technology layer. Now, why that is important is that value-based healthcare is really driven on data. It's really driven on big data, on patient data. And it looks at portions or fragments of the disease population or a population in general. And it says for these newly diagnosed diabetic patients, for instance, we are finding that patients reach X milestone in terms of their healthcare at month, whatever, at this cost. How can we make that, that timeline shorter? Because we know that the earlier patient reaches a certain milestone, the better their outcomes in the long run, less hospitalization, which obviously then reduces costs. So patient data is essential for value-based healthcare. And an interoperable system is essential in that we know that Dr. X and Dr. Y run different electronic medical record platforms. And we need all of those to speak to a central platform so that we can get population level data that will then be able to crunch those numbers, come out with some analyses on the other side so that we can then adapt our or amend our healthcare protocols, to reduce costs and efficiencies as well.
Now, this is so exciting, but I want to hear from you in terms of, because we understand when certain systems like this are thrown to, your regular South Africans, it's like we're ready to test this, to say, okay, I'm going to the clinic now to see is it really being, implemented. I want to know from you, how soon can this plan now be seen nationally or even just continentally so?
There are pockets of implementation of value-based care that has already begun and have for a few years, actually, even in South Africa. For instance, Discovery Health has what they call a shared value contract that they do with doctors, particularly in the private sector, as you can imagine, which are value-based contracts, which say if we as the funder and the provider can bring down the cost of care for this patient, we can then share on the upside, share on the savings. So that's what that shared value then represents. So those have been going on for a while. We have managed care organizations which are centered around focusing on one disease area, really becoming experts in that and making sure that they create a care plan for patients that qualify for that managed care organization and really bringing down that cost of care and creating a team of experts that can identify illnesses very early and just really make sure the patient's clinical outcomes are where they need to be. That's been going on for quite a long time. So you are seeing pockets of it, and you're seeing a lot of doctors in the private sector becoming part of what we call a network of providers specifically driven by a funder who is looking to bring down the cost of care. So the question for the ordinary citizen is next time you visit your doctor, whether it's a specialist or GP, to find out what network do you belong to, doctor, and what do those incentives look like so that you begin to understand how your doctor is measured. If I can just maybe speak about fee-for-service, and one of the reasons why we're looking to phase it out as quickly as possible is that on a volume-based system like fee-for-service, there was a lot of over-servicing. I'm sure you can remember times where you've been sent to a path lab so many times and you've had the same test done over and over and over again. Nobody is watching that currently with the fee-for-service, that you're doing the same test over and over again. Nobody's watching that you're overspending. Why does a doctor need to keep me in hospital overnight for observation? That doesn't make any sense. There's costs that are just happening that don't make any clinical sense for the patients.
Definitely.
So understanding how your doctor is paid, understanding what incentives kick in when will help you as a patient understand what your doctor is driving in terms of a healthcare plan for you.
And it can be so frustrating to a point that's why you get people who just don't want to be visiting the healthcare system anymore. They prefer in self-medicating and self-diagnosing, which actually speaks ill to, the nation itself. Now, just to close off our conversation, I want to know in what way can African countries develop legal frameworks? Because I think with such a very powerhouse, it's important to have legal frameworks that will cut out all, the corruptions and many other things that can, try and cripple the system. How can African countries develop legal frameworks that support both innovation in healthcare and protect that of patient rights?
Absolutely, that's again a big question. I think around legal frameworks, we need to get better at IP protection within the country or within the continent. Frankly, we need to strengthen. Where innovation happens in this continent, we need to make sure that we're protecting that with very strong IP rights that are then applicable globally, because we're seeing a lot of innovation happening in the continent that is then, because our IP structures or our IP frameworks are weak, they're being replicated elsewhere. So that would be the first thing I would say. And then we need to see governments being intentional about injecting money into healthcare innovation and health tech, and more universities offering kind of healthcare engineering or health tech as a course. I mean, they're so few and far between on the continent. So it's those kind of intentional steps that governments can take in terms of solidifying Africa as a continent of healthcare innovation that is worthy of rivaling any other country globally.
Now, I know I said that was my last question. Is there anything that you would like to share from your end before we close off our conversation?
I think from my end, what I would love for patients to walk away with, from these two discussions that you and I have had, is that you should not be kind of being pushed through a healthcare system that you don't understand. You need to take ownership of your own healthcare. You need to educate yourself around the healthcare structures within this country. You need to ask questions. Your doctor is not a demigod. Your doctor is a professional, and he's there to service you at that time. You are the client. We need to begin to have a consumer mindset. In every other service industry, we ask questions because we are the consumer. We demand specific things. We need to ask our doctor, now that I've been diagnosed with X, what is my care plan for this condition? Who is my care coordinator? Who will make sure that I get all the services that are required for me to hit my milestones? When I am in hospital, who is making sure that I'm not there for too long? What is this procedure? What are my alternatives? Do I need to be hospitalized, or can I do hospital at home, which is a cheaper alternative? So again, my takeaway message is be the owner of your own healthcare. Take charge of it, ask questions, and be informed. And if you need to get second, third opinions, but make sure you're getting the quality of healthcare that you deserve at the costs that make sense.
Nomfundo, thank you so much for such a fulfilling conversation. And I think it leaves us wanting to know more rather than just going through a system that just doesn't even wrap itself around us, just to use your words. Thank you so much for joining us.
It's been a pleasure. Thank you for having me.
Viewers at home, that was my guest, Nomfundo Khabela, sharing in, the importance of a value-based healthcare system and what it could potentially or offer the African continent. That's where we close it off for now.